Assalamu alaikum. Welcome to another video. In the previous video, we learned about P waves and few abnormal findings of P waves. In the next video, before we move on to PR interval, we will learn a little bit about cardiac conduction. We know that in a normal person, the pacemaker is the SA node, from where the electrical activities are carried down to the AV node. From AV node, it comes down through bundle of hairs and divides into right and left bundles. Then it ends as Purkinje fibers. When SA node depolarizes, the electrical activities move from the SA node towards the right atria and then to the left atria. This is when the whole of atria depolarizes and a P wave is formed. Few electrical activities touches AV node, but its conduction throughout the AV node is delayed. This delay is because AV node wants the atria to contract before the ventricle, and this delay is marked as PR segment. After this delay, the impulses are passed down to bundle of his, and after that right and left bundles. Bundle of his and the other bundles and the Purkinje fibers are like highway. They move faster than anything. That's when a QRS complex is formed. The Q waves are formed at this area where the septum is there, then the R waves, and finally the S waves over here. So it'll be like QRS. Once again QRS. So during this phase, atrial repolarization happens, but it will be masked by the QRS complex. Following the depolarization of the ventricles, there will be a brief period of nil electrical activity, which we can mark on ECG as ST segment, after which there will be repolarization of the ventricles, which we will mark as T segment. Sometimes we'll see a small U waves after the T waves, which is nothing but electrical activity at the papillary muscles. The basic idea which I wanted to convey was the P wave is formed by the depolarization of the atria, followed by the PR segment, which is due to the delay in the conduction through the AV node. Then I wanted to say that the bundle of his right and left bundles and the Purkinje fibers are like highway, national highways. Those electrical impulses move faster through these highways. That's why we have a QRS complex which is very quick. After that, we have a brief period of nil electrical activity, then the repolarization of the ventricles, and then the U waves. If there is any defect in the AV node, it will delay the PR segment. That's when we call hard block. That can vary according to the degree of block, which is first, second and third degree. We will talk about that in the next video. If there is delay in the conduction through the highway because of any blocks, then there will be widening of QRS complex. That's when we call the bundle branch blocks, where we have wide QRS complex. I just wanted to orient you towards this idea. With this idea, we will move on to further videos. I hope you're understanding these videos. If you have any queries, please do comment them in the comment section. If you have not watched my previous videos, please do watch them as well. Also, subscribe. Until then, take care.